Today in this video we are going to talk about one of the most important topic in the ammonia metabolism and one of the disorders that you should know very well, that is hyperammonemia. So the hyperammonemia, there are various causes of hyperammonemia. One is acquired hyperammonemia and there will be the hereditary hyperammonemia. The acquired hyperammonemia occurs due to various liver diseases, and the hereditary hyperammonemia occurs when there is the urea cycle enzyme deficiencies. So basically, if any acquired insult occurred to the liver, then there will be the acquired hyperammonemia, and when there is the hereditary deficiency of the enzyme in the urea cycle enzyme, then it will be the hereditary hyperammonemia. So what are the various clinical features that occur in the hyperammonemia? The person with the hyperammonemia will present with the flapping tremor. For example, hysterexis. There could be the slurring of the speech, somnolence, vomiting. We can find the features of the cerebral edema, or there could be the cerebral edema. There would also be the blurring of the vision. So as you can see in this reaction is that alpha ketoglutarate is converted to glutamate, and glutamate is ultimately converted to glutamine with the action of the ammonia. So increase now amount of the ammonia, it will change the amount of the alpha ketoglutarate, glutamate and GABA to favor the increased amount of the glutamine. So there will be the more consumption of the alpha ketoglutarate, there will be the more consumption of the glutamate, and also there will be the more consumption of the GABA. So CNS toxicity, how occurs? The CNS toxicity basically occurs due to the decreased amount of GABA, decreased amount of alpha ketoglutarate and TCA cycle inhibition. And the cerebral edema occurs due to the glutamine induced osmotic shift. It basically swells the brain. Now what is the treatment? Basically the treatment of hyperammonemia is to limit the protein in the diet, and what other various additional things we can give to the person of hyperammonemia is lactulose. And the lactulose is given to acidify the GI tract and trap the ammonium ion for the excretion. The lactulose acidify decreases the pH and it will trap the NS for ammonium ions. As you already know that ammonia occurs in the ammonium ion form. And also we can give the antibiotics. We can give antibiotics like rifaximin or neomycin to decrease the immunogenic bacteria. This antibiotic will kill the immunogenic bacteria, thus decrease the production of the ammonia. And also you can give the benzoate, phenyl acetate or phenyl butyrate. This benzoate, phenyl acetate or phenyl butyrate react with the glycine or glutamate that forms the product that are excreted renally. So these all are given to decrease the ammonia levels. So this concludes our topic on the hyperammonemia. Here we discuss the brief causes of the hyperammonemia. We discuss about the various clinical features, and we also discuss about how the CNS symptoms occurs and why the cerebral edema occurs in the hyperammonemia. And also we discuss about the treatment of the hyperammonemia. All the treatment are related to the decrease of ammonia level in our body. So this concludes our topic on hyperammonemia.